Hello, and thank you for joining us today. I am Neil Rainford, the Deputy Branch Chief of the Program Implementation and Evaluation Branch within the Division of Injury Prevention at CDC's National Center for Injury Prevention and Control. Some of you may be familiar with CDC's work responding to public health emergencies, such as the current COVID-19 pandemic, Ebola, and HIV. While we have a long history of responding to public health emergencies and outbreaks, CDC plays a large role in preventing injury and violence. I want to spend some time giving you a quick overview of CDC, our history, role in public health, and then give a brief summary of the Injury Center and where our work may complement yours. CDC was first organized in 1946 as the National Communicable Disease Center. Over the next few decades, the agency began to expand its work into HIV/AIDS research, vaccine guidance, and more. Public health data and surveillance became a strong cornerstone of our work. However, it wasn't until 1970 that the National Communicable Disease Center became the Centers for Disease Control. Shortly after, we began to expand beyond infectious diseases with a focus on preventable conditions such as cancer, diabetes, and heart disease. We also began examining injury-related causes of death, such as gun violence and violence against women and children. In 1985, the Institute of Medicine issued a landmark publication titled Injury in America, and the report called for the establishment of an injury center within CDC. Then in 1986, Congress responded by appropriating approximately $10 million to initiate this work at CDC. In 1992, we changed our name for the last time to the Centers for Disease Control and Prevention to reflect our broader role and mission. I, my many colleagues, we at CDC work 24/7, 365 to protect America from health, safety, and security threats, both foreign and domestic. As the nation's public health protection agency, CDC saves lives and protects people from health threats. To accomplish our mission, CDC conducts science and provides health information that protects our nation against expensive and dangerous health threats and responds when they arise. CDC aims to prevent and control the biggest health problems that cause death and disability for Americans. We've learned that it takes multiple sectors and partners to protect our communities and promote healthy and safe behaviors. Partnerships are fundamental to the work we do at CDC. CDC is made up of a wide array of staff, including epidemiologists, health communication specialists, lab technicians, public health evaluators, economists, and more. Everyone has a unique set of skills and play an important role in protecting the public's health. We realize that the future is dependent on preparing our current and next generations. While we have a number of training programs, we celebrate partnerships with organizations like Safe States Alliance to reach public health practitioners. The Injury Center has been focused on preventing injuries and violence through data, science, and action since 1992. We're a leading public health authority on injury and violence and is the only federal agency that addresses these key issues in non-occupational settings. Sadly, we know that injuries and violence are the leading cause of death for people between the ages of 1 and 44. This involves things like overdose, motor vehicle crashes, suicide, violence, and drowning. We've learned that injuries and violence have a tremendous public health impact beyond loss of loved ones, neighbors, and friends. They also have a national impact on issues surrounding hospital capacity, our productivity, and economic prosperity. Our center takes a public health approach to injury and violence prevention by tracking data and trends on fatal and non-fatal injuries, researching what works to prevent injuries and violence and putting them into practice and action, funding programs and activities to prevent overdose, suicide, and ACEs. We work with partners to raise awareness and provide Americans with information to protect themselves, their families, and the communities where they live, work, and play in. The Injury Center puts an emphasis on primary prevention, preventing injuries and violence before they happen. While preventing injuries and before they happen is the most effective way to reduce consequences, it is never too late to prevent further negative outcomes. With the changing nature of injury prevention work over the years, we recently undertook a center-wide reorganization, and most of our work falls under the purview of 3 strategic divisions. The Division of Injury Prevention, which focuses on things such as transportation safety, suicide prevention, traumatic brain injury, older adult falls, and drownings. This is the division where I work with my colleagues and our research at state and tribal partners to advance injury and violence prevention through our core state injury prevention program, tribal overdose, opioid prevention programs, and identify cutting-edge solutions by our injury control research centers. The Division of Overdose Prevention focuses on substance abuse and overdose prevention, while the Division of Violence Prevention focuses on adverse childhood experiences, intimate partner violence, and other community violence prevention issues. As you can tell, the Injury Center works across a diverse range of injury and violence prevention topics where there is a significant public health burden and where we can make an impact. Our center's three main priorities are preventing adverse childhood experiences, overdose, and suicide. Each of these has generational impact. And since preventing or addressing any one of these issues decreases the risk of others and for the next generation. At CDC, we're thrilled to be working with you and engaging with Safe States Alliance members and partners on this critical work. We're here to support the nation by responding to public health threats, and we look forward to learning and working together with you. Thank you for this opportunity to talk about some of the work CDC is doing to prevent injuries and violence.